And this is taking me back to a story that I remember. Joseph, who is in management at Our Revolution, he had the story about Joe Biden when the Obama administration first got into power, and they had expected the Obama administration obviously to take up the cause of unions and workers' rights, and that actually wasn't happening. But he tells the story about how Biden basically told him, you need to start pressing us, and that's when we'll respond. I mean, okay, so we could have the argument that that's ridiculous, that they shouldn't have to be pressed in order to respond, but then there's the reality, right? There's the reality. That is the reality. So what happens when union leadership has such a terrible disconnect from their members and they're not standing up for members' rights? And this is not the only example we see of this, where we've lost the power because union leaders, who, by the way, are elected by the union members. So I am a union member myself, full disclosure. So I often tell other union members, make sure you pay attention over who's in your leadership. Make sure that you're voting for somebody that's actually willing to fight the fight. Go on strike if necessary. Have the harsh words, the difficult conversations. Because if you don't elect those people to leadership positions, we end up in stories like what we're talking about right now, where they're absolutely rolling over for their workers, and it's unacceptable.
I think that's totally true. And something else that we've been noticing through the Ain't I a Woman campaign is that we have a problem on the American left when we rely so thoroughly on unions, because more and more, and especially right now during the pandemic, there are so many working class people who are perpetually out of work. Like Sarah was saying, we're seeing the rise of people being forced to do mandatory overtime or to work these very long hours that are dangerous for their health. But then on the flip side of that, we're seeing rising levels of unemployment. And for us, these are really two sides of the same coin. And it really points to the need for us to come together, across industry, whether we have jobs or not, whether we're unionized or not, and to really try to stand up for our rights as a class and really make this class demand to end the 24-hour day. Don't go down this dangerous path of limitless overtime, but really make a stand that we should have control over our working hours.
I absolutely agree with that. There should be no such thing as a 24-hour shift period, end of story. So most of these folks are CNAs, is my understanding, which means they're certified nurses assistants. So that's another layer to this. These folks are trained to do this job. Why is it even at a minimum wage level? To me, it seems like these folks should be getting $40, $50 an hour. Now, I understand that they're saying there's no money for that, but of course there's money for that. That's their argument for everything, right? Anything to do that doesn't benefit the plutonymy, the argument that always comes back is there's no money for it. But the minute the banksters get into trouble, all of a sudden there's $3 trillion to be handed out. So this just doesn't hold water.
That's correct. And I think that, like Sarah mentioned, I think there is a lot of racism behind it. I think there is a lot of sexism behind it. And also, I think that there's some ableism behind it, because when the Department of Labor put out an emergency regulation to make sure that the 24-hour shifts could continue, despite the workers winning in court and showing this shouldn't be happening, the Department of Labor really pitted the workers against the people receiving care as best as they could. And they said,
terrible.
If they said if the workers were to get the full pay for these shifts, that people would really have to end up going back towards institutions as opposed to home care services. And so they really try to make it this thing where there's just not the money, and if you want to try to fight and say there is the money, well, we're gonna try to threaten you. But people really see past this, and so that's why we've seen some groups coming forward, like the Disability Education and Advocacy Network of Western New York, that does represent and organize with people with disabilities and people who rely on these services.
Right.
And they're saying, we're not going to take this bluff. Nobody here would want to be given a medication by someone who's been awake for 48 hours.
Right.
If that's dangerous. That's not safe.
It's crazy. So basically they're trying to pit the folks receiving the care against the folks giving the care and saying there's no money here, when the money shouldn't come from either of these sides, right? That's the issue. This is a false argument, right?
Exactly.
The money should be coming from up here, right? Exactly. I mean, this is obvious to anybody that's looking at the situation. That's absolutely crazy. Let me ask you about
our money. I just want to add that it is actually our money, though, right? Because it's Medicaid. It's public
absolutely.
money. So actually, working people are paying into this, and then
that's right.
Getting it back through exploitation and a lack of decent care.
You are 100% right on that. And let's talk about COVID for a second, because I have no doubt in my mind that the situation we're in with the pandemic has made this much worse, right? So now there's probably another argument that they're trying to use. Well, we have a hard shortage of healthcare workers right now because of the pandemic. You have to work the 24 hours. There's no other solutions. And then what about protective equipment? Are these folks giving proper protective equipment when they're there working?
So they definitely aren't. And I'll let Sarah tell some stories from downstate. But up here in Buffalo, New York, there are agencies, of some home care workers that we've been organizing with that gave one reusable mask for the whole pandemic so far. One reusable mask. When when home care workers are working in a, patient-facing capacity where you have to be within 6 feet of the person that you're caring for and able in order to do your job. So the Ain't I a Woman campaign did fundraise and is still fundraising for PPE for home attendants. Sarah, do you want to talk a little more about that?
Sure. Yeah. I just started to laugh because you would think that the people who, are also elderly themselves a lot of the time, but taking care of the most vulnerable, it was like a sick joke during that time when we were at the height of the peak. Right. And, you had Governor Cuomo on TV every single day talking about we got to take care of the most vulnerable. He even passed a law named after his mother, Matilda's Law, saying anyone who comes into contact. And here are these home attendants who are the ones who are taking care of these people, being where, how am I supposed to protect myself? We had to, I felt like we had to move mountains to try to acquire masks at that time, because I don't know if you remember back in March, it was impossible. It was impossible for you to get your hands on any surgical masks. And but we did it because the government wasn't doing it, the agencies weren't doing it, the insurance companies were doing it, the union wasn't doing it. So what can we do, right? We pulled our money together. A lot of home attendants themselves, we did this. A lot of other people supported this effort. But still, to this day, there were times when it got slightly better. But, I think it does really show that, everything that we say about the campaign, right? Actually, it brought up a lot of questions. Actually, a lot of the home attendants who do the 24-hour work, we actually lost quite a few leaders and people got sick. And because a lot of what we say also about the campaign is the 24-hour has to end because it's so bad for workers' health, right? Mm-hmm. Our health is the most important thing. Without our health, what is anything, right?
Right. 100%.
Can't be compensated, and it was quite sad. You can see that these women could not. They talk about all of their chronic health problems, and when they got sick with COVID, they couldn't make it. It was just too much of a burden, and but it's quite it felt like during the pandemic times, it was the callousness of the system to just say our health, our lives just don't matter. But actually, it's much deeper than that, right? That this was just really thrown in our faces. But actually, that same attitude, that same system is all the time in the state, right? As long as we have such a system, that's just going to be cycling through these women, after another, and it's very tragic. On the other hand, I think, it did, I think it kind of pumped a lot of people up, a lot of the home attendants and also other workers from other industries to say we really need to end this. This is. We really need to take back control of our time. Mary kind of mentioned it before, but a lot of other industry workers. So Mary and I are both part of worker centers, so we're open to all trades, all different, workers from all different backgrounds, and even higher earners, even professional workers. Seeing their work time double, triple because of remote work, and then working parents who are now trying to juggle being their kid's parent and satisfying the your boss and whatever, and actually a lot of them who got fired during the make, because they were like, oh, you got to take care of your kid, too bad, you can't do this. And so,
yay, capitalism.
Yeah, but it was a good and necessary wake-up call, I think, right?
Oh yeah, I think the pandemic sort of was a reality check in many ways.
Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.